这支影片呢可能会颠覆你对德国护理师的想象。为了完整呈现影片中的所有细节我将访谈分成了上下两集，而本集的重点会锁定在一、德国护理师的工作内容是什么；二、德国的护病比，一个护士通常要照顾几个病人；三、德国护士的收入差不多是多少；四、他们每天基本的工作流程是什么；第五，德国是否也有类似台湾这种轮班地狱的问题。所以内容非常硬核，建议大家耐心的看完。那么话不多说，我们马上开始。嗨，大家好。我们都知道，在台湾护理师常被称为白衣天使嘛。但他们往往过着地狱般的生活，花花班低薪过劳都是问题。尤其是这些年我看到在网络上有很多人想当医护人员，但是因为台湾的环境太糟糕了，所以在寻求国外的工作机会，其中也不乏德国。也许你们会觉得，德国已经是一个已开发国家，福利很好，那薪水已经很高，生活跟工作的这个平衡一定也很好。那所以呢，我今天就请来了一位前德国的资深护理师，也就是我太太 Laura。她在德国医院和诊所已经打滚了多年，但是最后呢，她还是选择了离开。所以我们今天就会用问答的方式来让她和各位介绍这个德国的医疗人员的护理环境。然后为了证明我不是画胡乱所以呢，这是她当年在值班时的照片。所以接下来我们就会用访谈的方式呢，让你知道德国护理师真的有这么好吗？或是这只是另一个火坑而已。So Laura, welcome to the show. So are you ready to destroy some dreams?
好啦
OK. 所以首先我想让 Laura 给我们一个简短的自我介绍。你在德国做护士多久了以及你之前在什么样的部门工作
？So I worked in the hospital for 10 years in total. The first 6 years were operation assistants, so just with sleeping patients, which I can highly recommend. And the last 4 years were like on station, so like working with patients and doing the day routines and everything. The last 2 years were just like a really boring work actually, which was just like day work, no night shifts and anything. 10 years in total, and
pretty long. 10 years as a nurse.
Too long.
And you're both in clinic and a big hospital, right?
The first 6 years were in a clinic which just did operations. The last 4 years were in a hospital, which also had a private doctor downstairs. And the first 2 years, I was just like in the hospital. And the last 2 years in the private doctor's area, because I was thinking it's more chill. Because the last 2 years of my career, I was studying in the university. So daytime I was working, and nighttime I was studying for university.
Okay. So it was a hard time, huh? 好，那我们现在来开始进行我们的第一个问题。那我们的问题就是呢，在台湾护理师主要负责医疗行为，类似打针给药之类的。那洗澡换尿布这种通常是家属或是我们会请看护来做。那么在德国呢是什么样的状况？护理师也是要做这类的工作吗？还是说在德国他们也通常会请这个看护
？So in Germany it's a bit different because you are a doctor, psychologist, cleaning lady. You basically do everything, which is of course really hard body work, right? So first, you clean the patients, you do all the medical exams. You also help them eating, and like you do basically everything, and also, for example, the bill things.
So I think the most worst part is that as a nurse in Germany, you also need to clean the patients. You need to clean their poops, for example.
I wouldn't say it's the worst part, but it's just the most time consuming.
Okay. OK， 那第二个问题呢，就要来问一下我们这个在德国的护病比是多少了。所以说，你通常一个人在值班的时候要照顾几个病人
？So in one shift, normally you have 10 or 15 patients for one nurse, and 30 patients in total because you have 30 beds for one station.
Yeah, but not every hospital is like.
Mostly everything. Okay. Yeah. But I mean, I would say like 10 to 15. But, yeah, so that's the basic patients. And nighttime is 30 patients for one nurse because you have to say, in nighttime there's always one nurse less than during the day shift because there's less to do, right? You don't have to clean, you don't have to give food and everything because patients are sleeping. So you just do like if they need something, or you do the medical exams if there's needed, or medication. So there's less to do. I love night shifts.
So you say 10 to 15. Therefore, I assume that normally in the day shift there will be 2 to 3 nurses. Right, because then one nurse can take 10 to. Yeah,
there's 3 nurses because in the basic station there's one nurse who does the documentation and everything, or questions from other patients. But like just for the beds, for the ringing and everything, one nurse for 15 patients. So right side 15, left side 15, 2 nurses.
I mean, 10 to 15 for me sounds quite terrible because you also need to clean them, you need to feed them. Oh, that's a lot to do. Yes.
So I'm just talking about right now, like the regular nurse. Of course, when you do operation assistant, is way more chill. So you just have 3 to 5 operations for one day.
Okay.
And one operation is 1 to 2 hours, maybe. But preparing it, I mean, you need to sterilize it and do the sterilization of the instruments and everything. But it's more chill because you just have the 3 steps you do, and then you're done.
好，那我们接下来呢，就进入到第3个问题，非常重要，是关于钱，是关于钱的问题。所以大家最关心的还是钱嘛。所以呢，在德国的护理师啊，刚毕业的时候大概能领多少？是不是真的比台湾高很多呢？
So I would say it's definitely not enough for that what you do. When I was working as a nurse, I started with 1,200 after taxes. So I don't know, like maybe 2,000 with taxes, but in the last 4 or 5 years, many things changed because after COVID, everyone was like, oh, we need nurses, we need higher payments, blah, blah, blah. So the salary increased, but it's still not enough. So currently it's around 3,000. So it's just 2,400, 2,700 cash, like after taxes. But you have to think, in Germany, like rent is super high, gas is super high, public transportation is high. So you probably don't have enough money for a good life, right? True. So I think any office job who got the same salary, if you compare it, right, is human lives, and you still get the same salary as someone who's working in an office.
Yeah, true. So how much was it after you worked as 10 years nurse?
After 10 years, so the last year when I was working, maybe, I'm not 100% sure, maybe 1,900, like almost
after taxes. So will be
still less than 2,000. So, and that's the funny thing. When I was finished with university, in IT, my starter salary was higher than my 10-year nurse.
I think it's kind of unfair, right? Because the nurse is really hard work, like especially you need to take care of a lot of patients.
Of course, you have to say if you do a lot of night shifts, you get like 10 or 20% more, but still, I wouldn't say it's worth it. Even though you have 3,000 or 3,200, which is not too much in Germany, you still get that money with an IT degree or working in a bank or anywhere else. And night shifts are terrible, like after a long time. I mean, they're chill because you don't have too much to do, but it really damages your sleep And if you keep doing it for many, many years, you will get sick, right?
Because you need to work at midnight.
Yeah. And your body is tired, but you still work. And yeah.
So based on this question, because you talk about the night shift, that you need to work at the midnight, and I have an extra question for you that what is the daily process for the nurse, and how long is the coffee break, and also how many hours for a shift, and how many shifts a day?
So it's always 3 shift system, and it's from 6:30 or 6 until around 1 or 2. And then the next shift comes, and then the night shift is from 9:30 to 6 a.m. again. You always have to be there 1 hour earlier, so changing, and the last 30 minutes are like talk discussions about the patient, so you know what happened in the other shift. And the daily routine, I already said before, but for like normal nurse, it's just cleaning the patients, do medical exams, or like first shift from 6 to 1. There's always the boss doctor who comes around, and then you follow. You have to write down for new medication. Afternoon is, I think, really chill, because you just have to give the medication, prepare them for night. That's actually all you do. I would say morning shift is the most stressful one, and the most stressful one for your body is the night shift.
好，那我们接着进入到下一个问题。那我的第4个问题呢，就是这个轮班地狱的问题。在台湾啊，我们有所谓的花花班。那花花班呢，就是说几天白天的白班接几天夜班。那德国的排班制度有好一点吗？
We actually also have Huaban, but it's just like a bit different. It's just called like switching between the shifts. If there is a sick note or whatever, and or someone quit, then of course you do the day shift, for example. But I don't know, like, and you also have to do the night shift. So you just go home to rest. And of course, by law, you did the 9 hours of break, or 11 hours maybe. But still, it destroys your body, right? Because you just go home to sleep and eat. And of course, you cannot directly sleep. Like, you don't sleep enough. So yeah, we have the same thing, but of course it's not every day, but it happens a few times a week, maybe once a week or 2.
So actually the same issue, because Germany also lack of the nurses.
Yeah, we don't have enough nurses. And also, if you have nurse assistants, sometimes they cannot do a shift by themselves, right? Because they always need a nurse. So if you have like 6 nurses for one station, you can calculate how many times it happens.
OK， 听到这里，不知道各位有没有觉得德国和台湾的护理环境有什么不同？下一集呢，我们会谈到1，如果像在德国做护士、护理师，是否必须要会说德文呢？第2，台湾的学历啊、证照，德国承认吗？要重新上课吗？3，为何 Laura 最后还是选择离职，投身其他行业呢？第4，我们还会谈到毒品啊、性骚扰的问题。第5，给任何一个想来德国从事护理相关工作的人的建议。最后啊，如果你对本集内容有任何的问题，欢迎在下方留言，我们能够替你解答，或是以后再出相关的内容。如果啊，影片的内容对你有帮助，也请订阅并开启小铃铛。我们下周再见，悄悄。